Matters of nurses in the country, at the moment, we are not at our best. We have serious challenges that ought to be addressed. And very soon, we might be headed for a very serious national industrial action, because those issues, we have tried to have them resolved over almost 2 years now down the line, since this government came in place, and nothing has been resolved. And therefore, some of them are long-standing issues that have been with us for some time. So we are going to convene the National Governing Council someday this month, so that they can give me the authority to give the national strike notice to try to see if the government can address those issues.
One of the key issues that needs to be addressed.
Key issue number one is that the universal health coverage staff who have been working on dubious, illegal, and constitutional and contract that goes against the policies, employment policies of the country for the last 5 years. You cannot have children of people who have gone to school earning peanuts, like you're earning almost a third what your colleagues are earning in this economic hardship. And that small stipend they are being paid is also being deducted, subjected to all forms of deduction. So at the end of the day, a worker costs almost 30,000 shillings. What will you do with that one? Will that be transport? Will that one be house rent? Will that one be food? Will that be school for children? We find this as economic crime and economic supporting this group of workers, because they are Kenyans and they have a right to enjoy all the rights, because the nurses and other health workers, apart from the doctors, are the ones who are subjected to this kind of dubious employment, because doctors who are on UHC earn according to the SRC approved salaries that is contained in the CBA for the doctors. But these other health workers, including nurses, are the ones which are subjected to this dubious kind of work arrangement. And that's what you're saying. That's issue number one that must be resolved. We had been engaging the government for a very long time, and they have been telling us after the expiry of this contract, we are going to absorb them, we are going to factor money in the budget. This budget that is ongoing, that has not yet been approved by Parliament, we were promised, even Parliament debated, Senate debated, National Assembly, and also the Senate, and they agreed that money must be factored in the budget. But when we met CS Duale last week, he told us that, the money is not available, we are going to absorb them next year, we are going to transfer them to the counties with the current stimbet. So I said, this is a government that doesn't care. Why will you want to talk about universal health coverage when you are frustrating those very people who are supposed to be spearheading that universal health coverage? So as a professional, you cannot sit back and see our colleagues being frustrated, being mistreated, and clearly doing what you call economic sabotaging to our members and Kenyan citizens. The issue number two is about the staff shortage for the nurses across the country. The shortage for nurses across the country is so big that to say you can deliver healthcare services, you'll be lying. So that's the area that we want the government to approach to resolve. Because remember, when we came in power, I'm saying we, because at that time I was among the people who founded UDA, and we founded UDA on the foundation that is a government that's going to be listening, especially with the workers. You remember the nurses were the only union that supported this government. The other unions were with Azimio. But immediately we took our power, we changed into something that I don't know. So the issue of staff shortage, nurse shortage, must be addressed. Another issue that must be addressed is the return to work formula for the nurses of 2017. Government cannot be making promises and agreements with workers, and then the renege on those agreements for no good reason. You cannot tell us, for example, that there's no money. I have been looking at the budget. This is the first time I've scrutinized the budget, and I've told my experts to advise me on it. I've looked at, like, when the UHC staff only requires 3.5 billion on top of what is contained in the budget today, for them to go to permanent and pensionable and have a decent life. I looked at the budget, the office of the president. It has 2.5 billion for painting, to go and paint State House. Shamelessly. You know, these people do things like, they think Kenyans, you are so stupid, you are so dumb, we can't see what they're doing. That is actually legislating stealing. Why do you go and to paint State House 2.5 billion? The other time they were given money, when they went there, they renovated, they changed everything. They removed clubs where people go there and wine, they removed all those things. Now, they are saying they want to pay with 2.5 billion. They have allocated the office of the president 12.5 billion just for moving around the country and campaigning. campaigns are going to come in 2027. So I'm asking the president, if he cares for the people of Kenya, let him remove 3.5 billion from his 12 billion, from this 15 billion, to give to the universal health coverage staff for them to be absorbed. Nothing short of that. When we go on strike, we're not going to go back until these universal health coverage staff are absorbed and they are given an opportunity to live like other Kenyans, because the situation for them is pathetic. The children are being sent at home. You can imagine you are going home and you are working and your child has been told to come back home. You have no money. Some of them, they don't have school fees. Some of them, houses are being locked simply because we have some greedy men and women at the top of the government who don't care about everything. Why do you want 15 billion for painting and moving around the country when the core program that you wrote on to come to power was universal health coverage? Why can't you take 3.5 billion from a 15 billion and put that money in the universal health coverage? I'm telling the president, we will tell you these things without fear of contradiction, because these are our taxes. And we have every right to ask that our taxes must be properly utilized for the benefit of Kenyans. Yeah.
Talking matters nurses, very soon we're going to commemorate and celebrate the Nurses Week. Do we have anything to celebrate about for many years?
The fact that I'm here with you speaking about the plight of the nurses on the platform of the union is a fact to celebrate. That nurses have a platform through which they can air their views, they can approach their employers, and they can debate, and they can be defended. In the past, we didn't have a trade union, and people will just trod in on our rights. So we have that to celebrate. Despite the fact that we're saying that there is much that ought to be done for the nursing profession, we have progressed from where we were to a certain level. The truth is that we are not where we were 15 years ago. We have made tremendous improvement. If you take a nurse who retired like 10 years ago and you bring that nurse back to work and sees the working environment, he or she will see some slight improvement from where we were. The fact that we are agitating for better terms and condition of service, it doesn't mean that we have nothing to celebrate. For example, in the national government, the last employment that took place, immediately before devolution, they employed 300 nurses across the country. Immediately after devolution, a count like Machakos alone employed 800 nurses. One count alone. So the number of nurses in public sector, because of the county government's employment, moved from about 8,700 to now about 32,000. But that's still a drop in the sea, because we need about 120,000 nurses in public sector in Kenya. So you can see that gap is so big. And yet our government is not prioritizing health, is not doing anything. Another thing, I didn't mention that when you asked about the issues that will make us go on strike. The medical cover, nurses and other health workers are not able to access healthcare because the thing called SHA, they keep saying SHA is not working. When you go there, they tell you it's locked. Money has not been submitted, has been deducted, has not been remitted. These are not things that used to be there when it was UHC. One of the main problems that we have is to take public funds to be received and managed by private entities. So it's just about business. It is not about service delivery. If it was about service delivery, our money would not be being received by private entities and managed by private entities. No one has explained to us what was the problem when SHA was collecting that money. You said private institutions, private hospitals were stealing public funds. Now you have taken public funds and given the private entity legally. You have stolen it through the law. That's what they have done through SHA. Our money is not being collected by government. Public funds is being collected by private institutions. And these private institutions are forking out 104.8 billion. What they are calling a system of management, ITSP, what have you. These are things that could be done internally the way it has been done, the way NHIF had done over years. In fact, NHIF, what it used to do with the little it used to get from us is still superior compared to what SHA is giving today. That's a fact. SHA could be good, but it has not been properly implemented because of private corrupt interests. No one has told us why our money is being collected and managed by private entities. So I think, going back to the question of what is there for us to celebrate, I think I've mentioned to you that we have made strides in terms of improvement of the staff, though we are not where we're supposed to be. We have a platform where we can air our views, we can defend the rights of the nurses, and generally we are moving forward. And because of the activities and functions of this trade union, we will continue to improve the terms and conditions of service for the nurses. We have a situation where health workers, not even health workers alone, county public service employees, those who work at the county government, do not get salary even for 3 months. How do you expect them to survive? You know, if you're a public servant and you don't pay rent for 2 months and they have paid you salary, and your landlord comes and throws you out, and it is put on the media, you will be dismissed from the government employment on what they call pecuniary embarrassment. Now the government is the one that is pecuniarily embarrassing workers. What are workers supposed to do? You can't access medical cover, you have not paid your rent, you have no food, your children have been sent away from school, and then you are working for a government that is not bankrupt.